what are my most powerful treatment strategies to help people with metastasized cancer? This is what I do every day at my clinic from morning to evening. And this is the core group of patients who come to our place. They suffer from metastasized cancer. Metastasized cancer is a complex system disturbance. It's definitely a system disease where the terrain, the biochemical terrain in the body of a patient who suffers from the disease allows cancer cells to expand, to thrive. And there's a reason, or there are many reasons for it. It's a biochemical disturbance based on too much inflammation, too much toxicity, too high levels of stress hormones, too little water, too little oxygen in the tissues, infected areas, maybe root canal fillings that are infected, and so on. So we rehydrate, we replenish deficiencies, we stimulate the detox pathways by enemas, breathing exercises, heat therapy that helps the patients to sweat and to get rid of the toxic burden through the sweat pores. The most important tools that we use to turn around cancer growth are hypothermia together with high concentration infusions of naturopathic botanical anti-cancer drugs. Hypothermia means overheating, high temperature, hyperthermia. It's a controlled way to raise the temperature of the body, and there are two different strategies to do that. One is called whole-body hypothermia, and it's a way to induce fever under controlled circumstances. So with infrared lamps called water-filtered infrared A, we raise the body core temperature to 103 up to 105 Fahrenheit. Nature gave us the ability to raise the body temperature and activate our immune system, and that helps us to kill cancer cells. And it was a surgeon in New York in the 1880s, William Coley, who witnessed how nature cured cancer. A patient at his hospital suffered from a huge neck and throat cancer in a size that he was unable to operate on, and this patient got an infection on his ward. And within 6 weeks, the infection cured cancer, or the fever cured the tumor and melted away like a snowball in the sun. And there are photographs made out of it. You can still find the photo documentation of this first patient from 1886, Dr. William Coley. Coley was bold enough to say, if nature cures cancer with fever, let's induce fever and see if it is possible to put cancer into remission by causing a fever reaction. So that was the cradle of hypothermia. And today we don't use bacteria any longer. We do it a little more elegantly with infrared beds and water-filtered infrared light. Procedure takes 2 to 3 hours. We guide the patient through 2 hours of fever, and that is what we do alongside infusion therapy, because the combination is even better. It was developed in the 60s and 70s by a German physicist called Manfred von Ardenne. He was a genius physicist and developed color TV and electron microscopy. And at the end of his very successful life as a physicist, he became interested in the treatment of cancer. He was in close contact with the Nobel Prize laureate Otto Warburg from Berlin, who received the Nobel Prize in Medicine in 1932 because of his discoveries in cancer biology, that cancer cells live mostly from sugar and in the absence of oxygen. So von Ardenne picked that concept and created the cancer 3-step therapy. And that was hypothermia, the controlled fever with infrared lamps in combination with high dosage vitamin C and oxygen inhalation. So that's what we do. Hypothermia, combination with high dosage vitamin C and oxygen inhalation. At the same time, hypothermia needs to be combined with something else. It's a very good enhancement of other treatments, and most of all, infusion-based treatment gets a powerful enhancement, a synergy effect, if you do it under hypothermic circumstances. There are hundreds of clinical studies published that prove that hypothermia is a very powerful treatment enhancer for both radiation and infusional-based therapy. So it's a shame that it is not used everywhere. There was some clinical study done at Duke University and even at the University of Buffalo, but it never reached the level of acceptance in the United States. In Germany, we have a few university clinics that do clinical studies in Erlangen, in Berlin, but it's mainly in the hands of naturopathic doctors. And there are around 100 clinics that offer hypothermia treatment and provide patients with hypothermia in combination with other treatments. So it's a treatment enhancer. And the other way of working with hypothermia is so-called local hypothermia. It's done with very special devices that work with radio wave technology, 13 megahertz frequency. So it's a little bit comparable with microwave ovens, which I highly recommend to not use to prepare your food. But the technology can be used to overheat an organ that contains cancerous cells or lumps like the liver or the kidneys or lymph nodes. So with a somewhat lower frequency of 13 Hertz, we warm up the cancer tissues to a temperature of almost 110 Fahrenheit, and that induces cell death, apoptosis. It's not possible to warm up the entire body to 110 Fahrenheit. That would be lethal. But we can warm up the liver or a cancerous area of the body affected by cancerous lumps up to 110. And again, we do it in combination with infusion-based therapy. So high-dosage vitamin C together with local hypothermia, or Chinese wormwood, artesunate, which is a powerful botanical anti-cancer drug with almost no side effects. You have to be careful with the red blood cell count because it has an affinity to iron. It also affects a few red blood cells, so you have to monitor the patient's red blood cell count. But the toxicity is very little compared to standard chemotherapy. So artesunate or turmeric, which we have in an injectable form, is another powerful anti-cancer drug you can administer intravenously, and turmeric has no side effects at all. So all these botanical drugs is what we give in infusion and reach high levels in the patient's bloodstream. And this high level gives these botanical drugs a chance to show their power and to block cancer growth. I've never seen a dangerous fever from a common cold. Never, ever in my life. I believe that dangerous fever is extremely rare, and fever in itself is never dangerous, but you can do stupid things while you have fever, and that can be dangerous. So if you have a high fever, if your children have high fever, 104, 105, and you allow them to walk around and to get cold and to sweat and get cold and to exhaust themselves, that can be dangerous. Or it can be dangerous if you suppress the fever, but you only take away the symptom with paracetamol or aspirin, and the patient starts to feel a little better and exhausts himself, and that causes an aggravation of the symptoms, and that can be dangerous, and the patient can develop meningitis or something. But it's extremely rare. My understanding of fever is that it is nature's best way to help the body to overcome an infection and even to overcome cancer. It might not be enough once you have developed cancer to just treat it with fever, but it's a powerful way to stimulate your immune system to attack cancer or to keep cancer under control. A great tool to reduce cancerous masses is insulin potentiating therapy. So it was developed in Mexico in the 1930s, and ever since that it is taught by Mexican doctors, and there is a society of insulin potentiation therapy. I did some training in IPT and incorporated IPT at our clinic, and it's a very powerful tool. How does it work? You measure the blood sugar in a patient that comes with an empty stomach and calculate how much insulin the patient needs to get hypoglycemia at a level of 40 to 50 milligram per deciliter, which is the level of blood sugar where you feel weak, where you get a little sweaty on your forehead and feel a little shaky. And in this situation, when blood sugar is so low, cancer cells are in an enormous energy crisis. Because cancer cells love sugar and are dependent on sugar, they open their membranes to get the tiny little amounts of sugar that are left in your bloodstream, and that gives us the opportunity to treat them with poison sugar. We mainly use botanical anti-cancer drugs. After lowering the blood sugar to this level between 40 and 50 milligrams, we give our infusions with a combination of Chinese wormwood, turmeric, ginger extract, vitamin C, high dosage, and sometimes, if needed, low dosages of regular chemotherapy, and that's 10 to 15% of the regular dosage. It depends from case to case. In cases where you need a fast response, patients come and see us in a late stage situation. We need a fast response. In many cases, we do IPT with botanical drugs. In some cases, we add 10% of methotrexate or doxorubicin or gemcitabine. It works very well. We've seen very good results with it. We combine 10 milliliters of 40% glucose with the infusion, and within 10 to 15 minutes, blood sugar goes up to normal levels again. And under these 10 to 15 minutes, cancer cells absorb the anti-cancer drugs in a much higher concentration than what they would do under normal blood sugar circumstances. There is a preclinical study published in the 1980s that shows that the difference was 15,000 times higher uptake of methotrexate in breast cancer cells under hypoglycemic conditions compared to normal glycemic conditions. So we add oxygen therapies to this protocol with IPT. We do blood ozonization, which is a kind of immunotherapy. It stimulates the white blood cells to behave more actively, and it allows red blood cells to absorb more oxygen and release more oxygen. We work with pulse electromagnetic frequencies devices that enhance blood flow, support detoxification, and allow better oxygen absorption. We work with healthy food and healthy nutrition. We reduce the amount of animal food and animal proteins. Of course, we work with orthomolecular medicine and find the deficiencies. We do an intensive testing of vitamins, minerals, and trace elements in the patient's blood. We do whole blood analysis, a stool analysis to get a map about the microbiome that helps us to find out the right probiotic supplements. And last but not least, we work with the mind-body connection.